Welcome to the Vetnovation's Ultrasonography of the Adrenal Glands online teaching module. In this presentation, we will review the anatomy of the adrenal glands and the relationship to other organs and vasculature in the canine and feline abdomen. We will perform a systematic sonographic approach to the adrenal glands and surrounding vasculature and organs, identifying anatomical features and landmarks that aid in adrenal gland examination and recognition of normal versus abnormal states or conditions. Sonographic features of common adrenal gland pathology will be discussed, supported by ultrasound imaging, and followed by a short set of questions aimed at solidifying the comprehension and understanding of the key elements of adrenal gland pathology and ultrasonography. The adrenal glands are small paired structures located in the craniodorsal abdomen, medial to the ipsilateral kidney, and adjacent to the aorta on the left and the caudal vena cava on the right. Vascular mapping aids in localizing these glands, as the renal artery and vein are found just caudal, the craniomesenteric artery is found just cranial on the left, and the phrenico-abdominal artery and vein course dorsally and ventrally, respectively, in a transverse direction approximately mid-body of both glands. Normal glands are hypoechoic to the surrounding adipose tissue, and color Doppler aids in differentiation from the vasculature. Evaluation of these glands is best done with a second megahertz or higher linear or sector transducer. The ultrasonic evaluation of the adrenal glands is technically challenging, but is now considered part of a complete abdominal scan in both dogs and cats. The left adrenal gland is bilobed and shaped similar to a peanut, whereas the right adrenal gland may appear wedge-shaped or elongated and ovoid. The left adrenal can be imaged with the animal in dorsal or lateral recumbency depending on the operator preference, and gas or ingesta in the bowel. Scan the area medial to the left kidney to locate the renal artery and aorta. In a sagittal plane scanning cranially, the long tubular aorta can be visualized with a cranial directed hook-shaped renal artery followed by the craniomesenteric artery and celiac artery. The left adrenal is found cranial to the left renal artery and caudal to the craniomesenteric artery, just ventrolateral to the aorta, with the phrenico-abdominal artery and vein passing dorsally and ventrally at the mid-body of the left adrenal. In lateral recumbency, the right adrenal is found by placing a probe in the right paralumbar fossa, fanning the beam until the caudal vena cava is located. Don't apply too much pressure to collapse the thin-walled, low-pressure caudal vena cava, though. Use color Doppler to aid in vascular identification. Rock the probe cranially, fanning in a ventral dorsal direction to identify the right renal vein heading to the caudal vena cava. The craniomesenteric artery and celiac artery may also be seen just cranial. The right adrenal gland will be found dorsolateral to the caudal vena cava, cranial to the right renal vein and artery, and caudal to the craniomesenteric artery and celiac artery. Again, the right phrenico-abdominal artery and vein will be found to pass dorsal and ventral transversely to the mid-body of the right adrenal gland. The adrenal cortex, or hypoechoic area of the adrenal gland, is made up of three histologically different zones. Each zone secretes a different set of hormones responsible for different functions in the body. The zona glomerulosa, or outermost layer, secretes a mineralocorticoid, aldosterone, which is responsible for the regulation of salt and water balance in the body. The zona fasciculata, or middle layer, secretes glucocorticoids or cortisol, which are considered the stress hormones of the body. The zona reticularis, or the innermost cortical layer, secretes sex hormones such as progesterone, estrogen, and androgens. Though the adrenal cortex has three histologically differentiated layers, only two are usually seen sonographically. The capsule and the thin zona glomerulosa, which is responsible for producing the mineralocorticoids, are often seen as one layer. The next layer medially is the hypoechoic zona fasciculata, which produces the glucocorticoids. Medially to this is the zona reticularis, responsible for the sex hormone production. Finally, the adrenal medulla appears as a hypoechoic inner region and produces hormones related to stress and emotion. Note the relative size of the phreneco-abdominal vessels and their location with respect to the adrenal glands and the normal layering appearance of the cortex and medulla. The diagramized picture shows the location of the phreneco-abdominal veins relative to both adrenal glands and how they pass transversely through the mid-body of the glands. The upper left image shows the phreneco-abdominal vein in an adrenal longitudinal view, while the upper right image shows a transverse image of the phreneco-abdominal vein passing the adrenal gland heading towards the CVC, or caudal vena cava. The phreneco-abdominal artery can be seen leaving the aorta on the right as well. These images show the renal vessels at the caudal pole of the adrenal gland. The correct imaging plane may show the left renal artery hooking cranially towards the left renal hilum. These images show the major arterial branches in cross-section with the left adrenal glands in longitudinal. The phreneco-abdominals can be readily seen ventral to both adrenal glands. The left renal artery can be seen caudal to the gland, while the cranial mesenteric artery and celiac artery are just cranial. The left adrenal gland on the right is a longer variant of normal. The appearance of the cranial mesenteric artery on the right appears to be mid-left adrenal gland body and demonstrates that individual anatomy will have normal variations. We routinely measure the adrenal glands to get an idea if they are normal, enlarged, or small, and may fit with or support the clinical signs of the presenting patient. The maximal size of the adrenal gland at the caudal pole is the most reliable measure of adrenal gland size in dogs due to a wide variation in patient breed and size. A caudal pole diameter of 7.4 millimeters has been reported as the upper normal limit, beyond which the majority of these enlarged adrenal glands will have associated pathology. The normal length of adrenal glands can vary between 10 and 50 millimeters. Due to the uniformity of patient size, cats have a much tighter normal range with a caudal pole diameter of 4.3 millimeters and an overall length of 11 millimeters. Beyond these measurements, most cats will have adrenomegaly. Following diagnosis of abnormal adrenal gland size, the sonographer needs to determine if it is bilateral or unilateral, and does this variation support the clinical findings, and if so, why are the glands enlarged? Adrenal glands measuring greater than 2 centimeters in diameter have a greater chance of being neoplastic, whereas measurements of 1 to 2 centimeters may be either hyperplastic or neoplastic. Adrenal glands measuring greater than 4 centimeters are more likely to be malignant. Finding bilateral enlargement supports hyperplasia, but does not confirm it. Unilateral adrenomegaly is more consistent with neoplasia, and the contralateral gland may often be hypoplastic and smaller if the enlarged gland is productive. Adrenal gland finding aspirate or biopsy may be required to determine the etiology of the enlargement, but obviously great care and consideration is required in such a vascular area. These are some of the common conditions of adrenal glands and surrounding vasculature, and a careful ultrasonic examination will aid in their rule-out or diagnosis. Adrenal gland tumors, secreting and non-secreting, may involve the adrenal cortex, such as adenomas and adenocarcinomas, or the adrenal medulla and the chromaffin cells, such as pheochromocytoma. These tumors are often unilateral, but rarely can be found bilateral. Clinical signs may vary from none to life-threatening metastatic disease. Pituitary-dependent hyperadrenocorticism may be one of the more common conditions, depending on your demographics. These animals present with appropriate clinical signs of skin and coat changes, polyuria, polydipsia, polyphagia, appendious abdomen and panting, and hypertension, and will usually have bilaterally enlarged adrenal glands greater than 0.74 centimeters and less than 2 centimeters at the caudal pole. These hyperplastic, enlarged, and productive glands are this way due to a neoplastic process in the pituitary gland secreting ACTH. Hypoadrenocorticism is a state of reduced adrenal gland production of hormones caused by atrophy or a lymphocytic plasmacytic condition. Animals with smaller than normal adrenal glands and appropriate clinical signs of weakness, depression, dehydration, and collapse in supporting laboratory data are likely to have this condition. Neoplastic conditions of the adrenal glands or hyperplastic conditions can create a hypercoagulable state and vascular thrombosis formation, which needs to be ruled out. All adrenal tumors have the ability to locally invade surrounding vessels, such as the renal artery and vein, the caudal vena cava or aorta, and organs like the kidneys and liver. Endothelial damage will further exacerbate thrombus formation. Metastasis is a potential, and careful examination of all other abdominal organs and thoracic radiology are recommended. This first image shows a uniformly enlarged adrenal gland in contact with the associated kidney. This proximity makes it seem obvious that this kidney would be at risk for tumor invasion. Fine needle aspirate, biopsy, or surgical excision and histopathology would be necessary to identify the neoplastic tissue. However, some of these clinical signs and signalment may be helpful in understanding which cells of the adrenal gland became neoplastic. For example, this dog shows signs of a cortisol-secreting tumor or hyperplasia, which involves the cells of the zona fasciculata of the adrenal cortex, whereas this dog has the skin and coat changes of abnormal cells of the zona reticularis of the adrenal cortex secreting excessive adrenal androgens or progesterones. These are examples of two different neoplasms associated with the adrenal glands, in this case the left adrenal. The first shows a uniformly enlarged hypoechoic gland caused by metastasis of lymphoma, and the second shows an irregularly enlarged hypoechoic mass associated with the cranial dorsal pole of the left kidney. Fine needle aspiration or tissue core biopsy was required to diagnose these tumors. These images show different characteristics of adrenal neoplasia. The first shows an adrenal mass with a metastatic lesion found in the adjacent renal cortex. The upper right image shows a non-distinct renal cortex on the cranial pole with potential tumor invasion into this area. The renal cortex in both of these images shows a mottled hypoechoic echotexture at the location of tumor contact. The right lower image shows an adrenal tumor with increased peripheral vascularity, which is a sign consistent with neoplasia. The turbulent flow may indicate compression or invasion of the vasculature by the tumor. These high-quality images show neoplastic changes to adrenal glands where the affected tissue echogenicity can be compared to the normal adrenal gland tissue to give the sonographer a clue as to what part of the adrenal gland might have become neoplastic. The lower right image shows a normal right adrenal cortex and a growth of neoplastic tissue on the cranioventral aspect that has the same echogenicity as the adrenal medulla. There's evidence of dorsal caudal vena cava wall compression as well. Fine needle aspirate or biopsy is still required to confirm the abnormal tissue type, though. The upper two images of adrenal changes were incidental findings during abdominal scans of animals with no outward clinical signs. If an animal has no evidence of invasion into these glands or no outward clinical signs, and if fine needle aspirate or biopsy was not performed, then serial ultrasonic examinations every 1 to 3 months would be recommended to monitor for enlargement or progression of the lesion. Adrenal tumors are likely to metastasize to other organs, such as the lungs,